Time for Health Alerts, everybody. This week, Dr. Emerson Q here from UHC. Did I pronounce your name right there?
Yes,
Just
sir.
wanted to make sure. Pleasure to have you here.
Thank
and welcome
you.
to West Virginia, too. You and I were talking. You're actually originally from Chicago, then you went to D.C., and you came here just the past couple months, right?
Yep. Thank you for having me.
Yeah, we're glad to have you here.
Warm welcome.
So what we're talking about today, dry eyes. So can you start off just by giving us a good explanation about the condition and how it happens?
Okay, it's a very common condition. It's the most common reason people come in to see an eye care provider.
Okay.
Dry eye or dry eye syndrome is basically a condition where you don't produce enough tears or the right kind of tears. And we need tears to keep your eyes healthy and comfortable.
Okay, so what can some of the symptoms be? How do we know that, obviously, that we're getting dry eyes?
Excellent question. The most common cause or the most common symptom for dry eyes are burning, stinging, gritty sensation, like you feel like sands in your eye. We call that foreign body sensation. Sometimes when you look at somebody, you'll see mucus and strings that they'll pull out of the eyes.
Okay.
Interestingly enough, when you tear more, that's a paradoxical response. In other words, the eye senses it's dry, so it squirts tears out, and those aren't good tears.
Indeed. All right, so we have some of the symptoms up there on the screen for you. He also just went over some of them. Tell us how these symptoms are diagnosed and treated.
It's diagnosed with a comprehensive eye exam, paying special attention to the history and the medication list. For example, antihistamines can dry the eyes, antihypertensives, and my favorite, coffee, because it's a diuretic and it can make you lose volume.
Very interesting.
Water
So
volume.
coffee and tea drinkers.
Well, everything in moderation.
Yeah, exactly. So what about these artificial tears blocking your tear ducts in terms of the treatments, the surgery? Tell us more about those.
Excellent. So the way to treat it is non-preserved artificial tears. I have a sample here in the bottle or in the preservative-free type, and that's where you take the cap off and you can put it back on.
Okay.
This is usually a little gentler because there's no preservatives. It's kind of a pyramid how you treat things. So you go back to the teardrops, but if it gets more severe, then you can think about ointments or a punctal plug. And a punctal plug, you plug up the drainage system so you keep the tears around longer. Right. So you keep your tears around longer.
Okay.
Yeah.
What about the surgery?
Surgery, you can think about tarsorrhaphy, but that's a little bit for very severe cases.
Okay.
You can go to blindness from severe dry eye, but it's very rare.
All right. So I guess for people out there watching here tonight, give us some prevention tips that may help them.
You can absolutely prevent this. The non-preserved artificial tears, modify your environment, humidifier in your home at night when you sleep, or you can even have a desktop humidifier at work.
Okay.
An ointment before you go to bed at night, and a good pair of sunglasses. So something like this, so prevents the wind. So if you put this on, you want to make sure it's covered like a goggle type thing.
Something also a lot of people wear when they're cutting grass and stuff too.
Yeah, exactly. There's a lot of injuries from the cutting the grass and safety glasses.
We had up on the screen there too about a hairdryer. Why? I mean, I guess that obviously will dry them out.
It'll blow air and it'll evaporate. It'll cause evaporative tear loss. So a hairdryer.
All right. And one more thing I want to ask you about these omega-3 fatty acids.
Yes, you want to take nutritional supplements. Omega-3, we could talk for this for hours. Some of the other ones are flaxseed oil, borage oil. Those things have been shown to be an anti-inflammatory and improve the comfort of the eye. Also foods high in omega-3, such as salmon and walnuts.
Okay. All right. Excellent advice. We appreciate you coming in.
Thanks, Nate.
Talking to us about how to prevent dry eyes. That does it for Health Alerts. We're going to look at Christmas shopping. Yes, it's already begun. That's coming up next on 5 News at 5.